So the process for getting a medicine funded in New Zealand starts with getting the evidence right, and applications come from many sources, but most typically from the pharmaceutical industry, because the industry itself has generated most of the evidence, especially when it comes to a new medicine. The first step is that we get a clinical review by the Pharmacology and Therapeutics Advisory Committee, or PHARMAC as it's commonly referred to. And PHARMAC is a group of practicing clinical experts that provide us with advice. Now, PHARMAC itself may seek specialised advice from clinical experts in specific subjects. So it could be, for example, from doctors expert on treating cancer or treating heart disease. And they draw on that expertise in order to give PHARMAC the best advice it can in that assessment process. When PHARMAC's looking at the clinical assessment of an application for funding a new medicine, the sorts of things we're looking at are how well the medicine works, whether there are any other medicines that do the same job, whether there are particular patient populations that would benefit most, and how many patients might be able to access the treatment. We look at how much health is derived from the new treatment in both quality and quantity of duration of life. We look at the costs over the long run, and we also look at the costs or cost savings in the health sector elsewhere. So, for example, whether the medicine offers reduced hospitalisation, hospital visits into the future. Well, it typically takes 6 to 12 months for PHARMAC to complete an assessment of a new medicine, although if it's clear to us early on that there will be really major health benefits, that can be accelerated. If PHARMAC's not able to make funding available right away, we keep the application for funding under review because things change. The funding situation can change, prices can reduce, and evidence develops over time, which can lead to funding into the future. Sometimes PHARMAC will stop funding one brand of medicine in favour of another, and we do that because the new one can achieve the same benefits at a lower cost. That's important because for every dollar saved, that's money we can spend on new medicines for New Zealand patients. PHARMAC recognises that one size doesn't fit all in medicine, and sometimes if a medicine's not funded, exceptions need to be made. And we've set up a process just for that, so that patients can get funding just for them. It's called the Named Patient Pharmaceutical Assessment Scheme, and applications are made by the patient's doctor. For more detailed information, you can go to PHARMAC's website, pharmac.govt.nz, where you'll find a range of useful information sheets and fact sheets to help you understand how best to engage with us.